We have all of these hearings. Nobody takes responsibility for anything. It's always somebody else's fault or somebody else's responsibility. When we have a report that tells us very clearly that there was failures in governance, supervision, oversight, clinical practice, administrative processes, then there was clearly failures in management. And people need to step up and accept responsibility for failures in management. It never happens. It's not happening again here today, where people are not accepting responsibility for failures. And I accept that Mr Fitzgerald came into his post in 2020. Well, then we need to look at who was in the post before that. Is that person accepting responsibility? Because these failures had consequences for children. I want to just put very quickly a number of questions in relation to the treatment of the whistleblower. So, Mr Fitzgerald, is it your responsibility again to ensure that if there are allegations which have been raised by the whistleblower and then there is action taken on foot of those allegations, whose responsibility is it to engage with the whistleblower? Ultimately, at the top again, whose responsibility is it?
So I think I answered this, and I have to answer it very carefully, Deputy, because I don't want to specifically discuss this particular case. I don't think it is fair that we should be in a position of discussing a specific case in great detail. I just did say earlier on that the whistleblower, as you call it, the person actually worked very well in the context of identifying the problems and the issues that were there and working in order to try to ensure to resolve those particular issues for the children.
Can I ask Mr Fitzgerald if the whistleblower was asked to take time off?
I'm not commenting on that particular matter.
And why not?
Unfair to the,
but why is it unfair?
To the person.
But it's unfair. It would be unfair, Mr Fitzgerald, if he was asked to take time off. So if we can't get answers to that question, this is the Oireachtas Committee which is looking into these issues. One of the issues which arises out of this saga again is the treatment of a whistleblower. It's in the public domain. Lots of things have been said which may or may not be true. So we're here as Oireachtas members to get to the truth of what happened, to establish the facts of what happened. And you're sitting here again, the man who's responsible ultimately for answering these questions. You're saying you're not in the position to do so. So I'll put what would have been all of the questions I was going to put in relation to the whistleblower. So I was going to ask, was he asked as a whistleblower to take time off? Was he reassigned from his clinical duties? Was he removed from his clinical lead role? I think they're reasonable questions to ask. Here's a person that stepped forward, that outlined clearly what was wrong, and lots of issues are in the public domain. And what I'm asking is, are you in a position today to clear up once and for all if it was the case that this whistleblower either was asked to take time off, was reassigned from his clinical duties, or was removed from the clinical lead role that he was in?
As I said earlier, I'm not going to comment on those particular matters.
And why? Can you give me an answer as to why you won't comment?
So, Deputy, again, I'm going to come in and say that I am aware that the whistleblower, that the CEO has been in contact with the whistleblower and they have exchanged correspondences. It is not appropriate for us to answer the questions that you're asking in this forum. And
why not? But I don't understand why it's not appropriate to answer those questions. That process can be ongoing. I'm sure there's lots of processes ongoing. There's going to be an audit into CAMS across all of CAMS services. So, you know, we're asking questions on other issues when there is ongoing processes as well. So it strikes me again that here we are, the first opportunity we've had to put questions in relation to what happened to this whistleblower, and we can't get information. So when will those questions be answered? When will we know as Oireachtas members the questions I am putting, when can they be answered?
Deputy, there'll be a process underway in respect of the issues that have been raised by Dr. Sharman, as Michael said earlier, in terms of reviewing the concerns that he has raised, making sure they've been addressed, particularly in relation to the concerns he's raised about his own treatment, and they are being examined.
Well, I can just finally, one thing I'll say in the end, and it's just more of a comment than a question. You know, when people say that there is a lack of a culture of accountability and transparency in the HSE, I look to all of the good staff that work across the HSE, that work in our public hospitals, that work in our public services, who do great work. But I have to say at the top and at management level, there is not a culture of accountability and transparency. It is absolutely unacceptable that the questions I put cannot be answered. I don't accept the logic of the response that I got. What I will say is that the whistleblower, again, was treated very, very shabbily. And not for the first time, I have to say, when a whistleblower has come forward in relation to issues within the HSE. It's completely unacceptable. So the quicker that we have a new culture of accountability and transparency in our health services, the better.